If you've been dealing with things like fatigue, brain fog, weight gain, maybe low libido, you've probably been told that this is a hormone issue. The fact is, it's actually rarely a woman's hormones that are contributing to these problems, and it's usually something that's a lot deeper. Many women are prescribed hormones without real hormone testing, and many women are put on hormone replacement therapy that could actually be dangerous if it isn't a bioidentical version of that hormone. Your hormone replacement therapy can actually be masking the root cause of your dis-ease in your body. We could be looking at imbalances in your thyroid, in your gut, in your immunity, and those are the places where we really want to start before we prescribe hormone replacement therapy, which can oftentimes suppress a deeper problem. In this video, you're going to learn how to identify root cause of hormonal imbalances and whether you actually have a hormonal imbalance to begin with. So you're tired all of the time. Maybe your cycles are unpredictable, or you're entering into perimenopause and you're bleeding a lot, or you're not bleeding at all, and things just don't seem to make any sense. You're really just not feeling like you anymore. I'm sure you've been told, probably by multiple doctors and maybe even your friends, that it must be your hormones. Maybe you're actually even taking hormone replacement therapy and you really don't feel that different. Or probably more likely, you've had your hormones tested and your blood work to your doctor looks normal. I understand that someone like you wants answers and not just another pill. Well, in today's video, I'm going to show you what most providers miss on your blood work and what you can do to advocate for yourself and start to feel like you again. Welcome back to the Dr. Britney, Your Other Doctor channel, where I help you decode your blood work so that you can get to the root cause of dis-ease in your body. Let's get started. You're not broken. You're just being squeezed into a one-size-fits-all type of treatment. Most clinics and even med spas nowadays are handing out hormone replacement therapy like getting a facial. The truth is, you need a provider who understands the full spectrum of the way that hormones communicate with the other organs in your body. If you're not looking at hormones from a root cause perspective, if you're not evaluating the other systems of your body, then you could be missing something really big as far as root cause is concerned. There are a lot of common causes of hormone imbalances. And it's important that we understand what a hormone imbalance even means, because many times you are either not being tested appropriately for hormones or you're not being tested for hormones at all. You want to make sure that your provider knows exactly what to look for when they're looking at your hormone labs, what time of the day or even of the week or of the month to be testing your hormones and why that even matters, how old you are, where you are in your cycle. Those are all things that matter deeply when it comes to evaluating whether someone has a true hormone problem. So what are the common things that can lead to hormone imbalances? First and foremost, other hormone imbalances, but those could be coming from a place of deeper inflammation. So for example, if you have an autoimmune condition that's causing dysregulation of adrenal hormones or thyroid hormones, if you have a nervous system dysregulation that's affecting your circadian rhythm, all of those will have an effect on what we typically think of as sex hormones, things like estradiol, progesterone, and to a lesser extent, but just as important, testosterone levels. Gut problems and poor methylation in your liver, the ability to detox and conjugate hormones, can also lead to issues with hormone regulation, as well as mitochondrial damage, since our mitochondria, the powerhouse of the cell, is mostly responsible for activating and creating these hormones. If no one has run a full lab panel on your hormones and sat with you and explained to you exactly what that means, then you might need to look for another doctor, especially if you've already been put on some kind of replacement therapy. If you're going to take hormones, you deserve to know what your body actually needs, not just a guess. Most physicians will test, if they test at all, estrogen, progesterone, maybe testosterone, around, but very rarely, and these are just the tip of the iceberg. What we want to look for, especially here at Red River, is we want to evaluate how every single organ system in your body is communicating with each other, and that involves looking at a lot more hormones than what you would just typically think of as your sex hormones. We want to check for gut and liver problems, adrenal stress, as well as thyroid insufficiencies and other autoimmune conditions that can cause underlying inflammation. We also look at how your body is metabolizing hormones, since you can have plenty of hormone in circulation, but it doesn't mean that you're actually able to use it. These are subclinical issues that often get missed. Symptoms don't lie, but they also don't always mean what you think. Hormone therapy isn't all bad, but it does have a time and a place, and it's not a quick fix for most of your symptoms, even though that's probably what you've heard. Hormone replacement therapy can be helpful in things like surgical menopause or even medication-induced menopause, in conditions where you have an overabundance or a deficiency truly in your sex hormones, and for perimenopausal and menopausal symptoms. It's important that we map the body as far as what its natural course would be with your hormones. We want to consider that when we're considering putting someone on a replacement. For example, a cycling female is going to want different types of hormones at different points in her cycle if she needs them than a perimenopausal or menopausal female would. And hormone replacement therapy only works if your body is ready to receive it. What that means is that we've addressed other underlying causes of inflammation first. So how can we heal a hormonal imbalance, assuming that that's been tested for and confirmed, without hormone replacement therapy? Because we always want to work from a conservative perspective first. Well, first and foremost, we want to make sure that we are addressing inflammation. Inflammation can come from quite a few different places. We can see a lot of these on your blood work, but oftentimes it takes clinical symptoms for us to put together the full picture of an inflammatory process. When we're looking for inflammation, we are addressing autoimmune issues, food sensitivities, detoxification problems, and stress. There's a lot that you can do on your own as far as putting yourself on an anti-inflammatory plan, like a diet, and taking care of any external stressors that you have control over, and then relying on your physician to teach you about the internal sources of stress in your body. We also want to heal your gut, since hormone detox happens in your digestive tract and your liver. If we can support digestion, reduce food sensitivities, support liver metabolism, then we can get better values out of your hormones. Next, we want to make sure that we are rebalancing your thyroid and evaluating it in an appropriate way. Evaluating a thyroid is much more in-depth than just running something like a TSH. When we're looking at your thyroid, we are looking in detail at every single part of that feedback loop. We also want to address if there's an autoimmune condition that could be affecting your thyroid as well. Thyroid hormones play a huge role in your sex hormone production. There are key nutrients that we need to make sure that we have, things like magnesium, vitamin B6, and honestly most B vitamins, and zinc, selenium, iron. There are so many minerals and vitamins that are important for making sure that you have what you need to even create hormones. One that isn't thought of often, and it's crazy that they even consider something like cholesterol to be okay if it's a 0 on your blood work, but we need LDL cholesterol in order to produce hormones. So if you're taking something like a statin drug, if you've been told that you have high cholesterol and your doctor is doing whatever they can to get your cholesterol as low as possible, you are not going to be able to create sex hormones. Lastly, we want to make sure that we are looking at things like adrenal stress. If your adrenals are over-functioning or under-functioning, that will have a drastic effect on your ability to create sex hormones and use them as well. I would suggest that you take a moment and try addressing things like stress and inflammation on your own through diet and lifestyle changes, and see if that makes a difference before going into something bigger and less conservative like hormone replacement therapy. If you treat the root cause, oftentimes the hormones will balance themselves out. There's something interesting that I want to share with you guys, and it shows that we're moving in the right direction as far as the system of medicine in our country goes, but I'm not sure that most people really understand what that direction is. To give you an example, we're now hearing that things like low-dose naltrexone is helpful for infertility. That has absolutely nothing to do with hormone regulation. And again, I'm not sure that the system quite understands why it's working, but I'm here to tell you why it's working. Naltrexone in normal doses, something like 50 to 100 milligrams, is actually used to help treat addictive disorders, alcoholism, opioid addictions, things like that. But we've discovered at low doses, and naturopaths have been using low-dose naltrexone for quite some time. In low doses, it's actually really helpful for reducing inflammation, particularly autoimmune inflammation. So now we're seeing low-dose naltrexone being pushed as an infertility drug. And the reason for that, again, has nothing to do with the fact that it's balancing any hormones and everything to do with the fact that it's reducing inflammation. A body will not get pregnant if it's inflamed. So we can help people to bring a pregnancy into their life and fully develop a baby if we can address the inflammation. However, low-dose naltrexone is still just a Band-Aid on a much deeper problem. So now you know why hormone replacement therapy is often overused and widely misunderstood. Hopefully you have some tips and tricks to try so that you can balance your hormones naturally. And I also hope that you stop blaming hormones for everything that's going on in your body, since most of the time there's a deeper issue at hand. I want you to make sure that you test and don't guess, and advocate for that with your physician. Identify hidden stressors like gut dysfunction, thyroid issues, autoimmunity, food sensitivities, adrenal problems. Start supporting your body naturally by helping yourself help yourself, making diet changes and lifestyle changes that help to reduce stress and inflammation. And we can do these things alongside a bioidentical hormone replacement if that's required. Remember, your symptoms are real, but so is the approach of looking at things from a root cause perspective. If stress is ruining your life or running your life, I've actually created a free guide on how to identify autoimmunity and reduce inflammation so that you can get rid of things like the brain fog, fatigue, weight gain, mood changes, and I want to make sure that that is available for you guys whenever you need it. You can download that free autoimmune guide now. Do you want even greater control of your health? Watch this next video for powerful strategies to balance your hormones, reduce stress, and restore energy. Click here, and I will see you guys there.